Welcome to the Startup Operator podcast. I'm Roshan Cariappa. One of the things that I'm really optimistic about is that we have young entrepreneurs solving for conventional industries like insurance with first principles thinking. My guest today is Mayank Kale, who is the co-founder and CEO of Loop Health, that is trying to proactively improve employee wellness and drive adoption in group health insurance. I spoke to Mayank about everything that's happening in the sector, how he is partnering with incumbents in the ecosystem, and is also optimizing for NPS and customer experience. This was a wonderful conversation with a passionate young entrepreneur, and it made me feel very optimistic for India. And I'm sure it'll have the same effect on you as well. So without further ado, let's get into this episode of the Startup Operator podcast with Mayank Kale of Loop Health. Hey Mayank, welcome to the Startup Operator podcast. Thank you so much for making the time.
Hey Roshan, nice to be here.
Yeah. So Mayank, lots to talk about. To begin things, I'd love for you to talk about everything that's happening in insurance in India. It seems like an industry that was in a slumber for a long time, but it has suddenly woken up over the last 5-10 years with everything that's happening, right? InsurTech and so on. What do you see happening? How are things shifting?
Yeah, it's a really exciting time to be in insurance, obviously. Maybe I can specifically talk about health insurance because that's what I'm most familiar with. I think because of just COVID over the last 2 years, we've seen an enormous growth in both the retail and the group insurance space. Retail has grown. The growth rate is kind of 3x in the last year. And so that's definitely growing really rapidly as people wake up to the fact that there's a high probability they might end up in the hospital and having to pay upwards of 4-5 lakh rupees for that hospitalization. And in addition to that, I think we're also seeing group insurance grow very quickly. Before the pandemic, it was probably growing in the double digits because companies wanted to be competitive with other companies coming in. But because of the legal mandate last year from the government, I think we've seen a much faster growth rate over the last year and a half. Apart from the market specifically, I think we're also seeing regulators be very friendly with new entrants. I think we've had 2 insurtechs get kind of digital licenses. So Agro and Digit get insurance licenses in the last couple of years. I think that has opened up a lot of competition in the space and a lot of movement. And we've also seen Paytm, Navi buy a traditional insurer. So pretty exciting time.
Yeah, for sure. As you mentioned, I think IRDA also has been extremely proactive on some of these fronts, right? And for sure. But you don't have a conventional insurance background, right? And in many ways, I feel that's perfect because you get to reimagine what ideal customer experience could be like without the baggage of, what works, what doesn't. But it can also be difficult in other ways, right? So what is it like building in this insurance space through first principles?
Yeah, you're right. I think my background is in computer science. I'm studying computer science and engineer at heart. I think what we're building is we don't think about what we're building as building in insurance. I think what we're really trying to do is fundamentally reimagine healthcare and what it should look like, because insurance is the primary way urban Indians pay for their health. That is the first place for us to begin with. But the way we started the company, I was in the US, I was studying computer science, like I mentioned, and my dad in Pune, he had a heart attack and I had to take about a year off of school to kind of be here and take care of him. And I saw essentially the pure lack of primary care that we have in this country, and saw that he was basically diagnosed with heart disease and got prescribed a really invasive heart surgery that we later found out he didn't need. And when I kind of dug into the financial incentives that drive this kind of behavior in the health system, what you realize is because patient might have insurance, doctors are free to prescribe essentially as many kind of surgeries as they want. And there are obviously revenue targets attached and so on and so forth. And so fundamentally, I think I started off thinking about, how do you bring incentive alignment into healthcare? And that's kind of the first place for us to start. And insurance ended up being the fastest growing, most predictable payment mechanism in healthcare. And that's why we're kind of attacking it first.
Right. And I think most people would pay for insurance through their formal, their employee benefits or something of that sort. But if you look at it, the adoption is not that great, right? I myself have insurance from my employer, but I also have topped it a couple of times. And that seems to be the common behavior, at least, right? So what do you see as a specific problem in terms of adopting group health insurance?
at least before COVID, there really wasn't a dying need for companies to go out and purchase group insurance. And so it was definitely a case of the market just being too small. I think COVID has definitely changed that, and the legal mandate has changed that as well. But one of the challenges that maybe a lot of the smaller companies face is not knowing where to begin and are not understanding what the terms are and not kind of being sure how it's going to be helpful for their employees. And so, they see maybe the mandate, they see buzz around in HR circles and so on and so forth. And then they say, I want to go purchase a plan. But you can imagine if you're a founder of, let's say, an 8-person company, you already are strapped for time, and then you going and trying to find the right insurance for your team at a price you can afford. It just ends up being too much. And so most folks just end up delaying their decision for months. And that we've seen as a big kind of point of friction in the adoption here on the group side, at least.
Right. So, you start off with this very ambitious aim of aligning incentives within the healthcare space, right? And so how did you go from idea to product to company? What were the first few steps that you took, and what has that journey been like over the last couple of years or so?
Yeah. I think, I just graduated a few years ago, but while I was still in college, thought of working in the digital health record space, obviously thinking about data being super important in terms of trying to obviously make healthcare outcomes better and diagnosis better and so on and so forth. So build some products there and quickly iterated along the way. Important for me is to try to understand where to start. And, with this ambitious aim of saying, how do you rewrite healthcare? The idea was to not necessarily disrupt it. I think there's a common term of kind of, we want to disrupt insurance or disrupt healthcare. Those are such core utilities that people seek safety, not novelty. Here was, you want to bring something that folks are familiar with, like group insurance, and you start to innovate where you can. So, the first thing we did when we realized that, the biggest thing that's lacking in the insurance space is, one, a better experience around buying and claims. Two, I think most HRs have wanted to provide much more useful health benefits. And so when we kind of realized that, and we said, look, we can build this product ourselves where we can bundle your group insurance with free unlimited primary healthcare, where you can actually make the benefit more useful and you can catch people in the beginning of their care journey and not at the end of it, like traditional insurance does. And kind of recognizing that insight and saying, look, if we build an amazing product, we can go out and get a customers, and that could be an amazing wedge to then start building this kind of new health system that we think about.
Right. And also being a computer science guy, I mean, you would have thought of, all the tech interventions possible in this entire journey, right? In the customer lifecycle itself. So could you talk us through, what that is like?
Yeah, I think there's 3 key parts of the life cycle. I think there's purchase, there's use of insurance, and then there's use of healthcare. I think on the purchase side, we've made it super simple by integrating very closely with some of our insurance partners, where you can customize your group policy, you get pricing that's really transparent, and you can just really easily understand the implications of some of the choices you're making in purchasing the group policy. In terms of the usage experience, I mean, I would say this is day one, early days for us and the whole industry, trying to think about how to make claims better. I think we've built a lot of rails for people to come and claim through Loop, where we've made it easy for folks to understand what to put together. We've made it easy for our insurance partners to take our claims and say, if they're coming from Loop, they're probably good because we've run them through a bunch of checks, both automated and manual as well. So on the claim side, making the front end easy, the skin of the experience, and then on the back end, making sure that we're still trusted on the claims delivery. I think that's the second piece. And then the third, I think, most important piece is the healthcare, because that's what, again, most people end up using. Because of COVID, I think we've seen massive adoption in just telemedicine and trying to talk to doctors on the phone. And so we've actually invested a lot in building tools that enable our full-time doctors to deliver instant, really great care. So, when you sign up on Loop, you get assigned a medical advisor that you can text, call anytime you want. Typically, the care team texts you back within 50 seconds. And we make it possible through a lot of technology. And, we're also able to then collect really great information on what kind of diseases you're going through and how do we get you the best outcome possible.
Right. So with this value proposition, who were the first few customers that you went to, and then what have you learned about the whole acquisition process itself over the last few years that you've been selling this?
Yeah, I think primarily we went to both customers that have never bought insurance before and again, HRs and companies that have been buying for a few years but are looking for a better experience. What we learned is, both of these markets are absolutely massive and products just aren't that much different. And so we went after both of these kinds of companies, obviously starting out with people we knew, and then they started telling their friends about it. And I think word of mouth started to grow for us very quickly. I think what we've learned primarily about acquisition is buying insurance and buying healthcare are both about trust, right? You need to be able to trust the person and the brand and the product before you make a purchase decision. And so we do spend a lot of time thinking about how can we be the most trustworthy brand in healthcare and insurance? How can we show up to companies credibly, maybe advise them on their insurance and help them purchase the best plan possible?
Right. So one thing that's happened with a lot of new age companies that have come into insurance is that there's a greater focus on customer experience, and it's not just about stocking someone with a policy, but it's also ensuring that the post purchase experience is also like seamless, right? And those things. But do you see a situation where there will be a lot more people like Loop Health itself come into the space? And if that is the case, what would your differentiator be? I mean, would you at some point would you become a carrier yourself? I mean, would you like apply for a license or something like that?
Yeah, I think there's two parts to the question. I think the first one being more players coming to the space. I think this is such a massive market that we almost wish that more people were in it so that you expand it and just make it much bigger for everyone. Penetration is only about 15% of health insurance. And so I think absolutely, more players coming in, the better. I think the way the industry is shaken out, both on the carrier side and the broker side, is there's a lot of regional oligopolies that have shown up. And I think that's typical of markets where you require a lot of trust to be built in the selling and acquisition process. So it's not necessarily this winner take all type of situation that a lot of other maybe purely tech markets face. So I think what we look at very closely is the customer. We want to continue differentiating ourselves by investing both in the customer experience and providing more value both on the healthcare and the insurance side and as much as we can. So I think that probably answers your question.
Hello, everyone. You can get back to your regular programming in less than a minute. An interesting newsletter that I came across is The Gist. The Gist basically curates and explains the most important business and startup news from India in a very fun way. Their articles are very comprehensive. They cover all the important points, but aren't so long that it becomes boring to read. I believe it's a great way for young professionals or students to keep in touch with the ever evolving and changing landscape of India's business and startup ecosystem. So head over to The Gist, that's gyst.com, and let me know what you think. The link is in the show notes. Right. I love what you mentioned earlier, which is that it's not about disruption. Disruption can be seen as a novelty, but it's about building trust and so on. And insurance is a space where you have so many incumbents, right? It's such a complex ecosystem, whether it's the carriers, the brokers, the TPS, and whatnot, right? How are you partnering with these various entities in the ecosystem, and what is that conversation like, right? I mean, a guy in his 20s going up to these guys in suits and asking them to partner with this new type of insurance experience.
Mm-hmm. It's honestly been quite an interesting experience, to say the very least. I think what we realized early on is in any partnership, obviously, you need to produce more value together than you would have by not partnering. And so what we focused on in the very early days is what can we provide to these insurers that they don't have today, so that they may kind of start supporting us and so on and so forth. So I think, what we did early on was just go to a lot of these incumbent insurers and say, look, we are going to give you access to a new type of market that you haven't gone after. And we are going to give away a lot of healthcare value as well, where we have capabilities that we've built and maybe you haven't built there. And that was a really exciting value proposition for a lot of insurers. And we found a few of them very willing to be patient with us and say, look, let us build things with you. We'll be patient for 6 months, 1 year, 2 years to see the business rolling in, because we do recognize that technology and kind of fast growing spaces where the exposure needs to happen. And so we actually found a couple of these incumbent insurers to be absolutely willing to help us and start kind of building a better and better value proposition with us.
Right. Yeah, that's also been my experience actually when I talk to insurance leaders and so on, right? They have been entirely open to change, given that, there's been so much of disruption in whether it's fintech or insurtech that's happened over the last 10 years. We've spoken a fair bit about customer experience, right? Now, for a long time, I think NPS is a four-letter word in insurance, at least specifically. But you're trying to drive this better customer experience, and that goes well beyond having a proper UX on your screens and whatnot, right? I mean, it requires a lot more than that. So how are you optimizing for better NPS in loop?
Yeah, I think, like I said, I think both insurance and healthcare are about trust. And there's nothing more trustworthy than a human. And what we've seen is these typically kind of these failed attempts at completely automating or completely digitizing things, where you don't want to talk to a chatbot if you're sick. You don't want to rely on an AI to make sure that your claim is processed well. And so the way we think about NPS is how do we combine humans and really great technology to be able to deliver an amazing experience. And so the two places where people find the most friction in insurance is one, understanding their insurance policy, and two, kind of claiming it, right? And on both ends, I think what we've done is through a mix of technology and humans, made it really easy for people to get the job done, right? So how do you understand your insurance policy? Well, you can read it on our app that is explained in really simple terms, or you can quickly text someone on the team and we'll jump on the chat and quickly kind of explain it to you using videos and images and so on and so forth. So that's how we've kind of solved that problem. And then on the claim side as well, I think, again, making it really simple to understand what the claims process is, how much can you actually claim, and then both from a digital journey and a claims advisor on our end, helping you to drive that through completion so that you leave the hospital in no time or you get your reimbursement done very quickly. And so our approach here is a bit different than maybe some of the other players that you may speak with. We believe that humans are at the center of building trust, and we want to make sure that we complement them with the right technology.
Yeah, I think that's absolutely true, right? I mean, I think for any of the operational administrative tasks, technology can still automate all of those away. But when it comes to care and consulting and those kind of things, I think, we would love to talk to humans, right? For sure. We're also seeing a lot of regulatory tailwinds, right? The government and the regulators have been extremely proactive. I think even the Prime Minister mentioned recently in a speech about the 40 crore, the missing middle, he called it, right? I mean, who have to access insurance. So we're seeing a bunch of things, FDI being expanded, the Jan Arogya Yojana, right? PMJ, the health stack, which is going to come up and stuff. So it seems like a lot of things are happening, right? Would love to get your comments on, how this is going to impact all of us in the years to come.
Mm-hmm. Yeah, I think my opinion on this is regulation is great. I think, again, this is the industry where disruption is not the end all be all. I think safety, security, making sure that things work are really important. And so we're kind of big fans of the regulators and regulation at large. I think what the regulators have started doing right though in the last couple of years is balancing this idea of regulation and downside protection with liberalization, where you start right, and innovation, where you start allowing new players to quickly iterate. And so you see things like the IRDA sandbox where you can file products and quickly start to iterate. You see, again, FDI being liberalized both in the broking space and in kind of filing for carriers. We're going to see a lot of movement and growth in those areas as well. And I think the national health stack is another really ambitious project, I think, that the government's taken on. I will say that it is a slightly different than UPI. I think we see a lot of people compare it to UPI, but payments and finance is, like you said, an administrative task that can be automated away. Healthcare is not. I think being able to use the national health stack, you need buy-in from hospitals, doctors, insurance companies, and all of that. So I think the conceptualization of what it could look like is brilliant. I think we're going to need to make it really easy for everyone in the industry to come in and say, look, I want to do this. Here's why. Here are my incentives to participate in the national health stack, so that we can kind of make it happen. And so, yeah, I mean, like I said, I think the regulators, I think, are doing a pretty great job at saying, it's our responsibility to protect the consumer, and we want to allow newer companies to come in and build in the space.
Right. So I find it super inspiring that someone without an insurance background, someone as young as yourself, is reimagining this entire experience, which is such a fundamental utility, right? It's pretty amazing. For someone else who wants to be another Mayank and come and build in insurance, right? So what are some nuances of operating in this space? What should they know about this space that could help them build?
Yeah, I think maybe just carry over from our last point of discussion. I think regulation, again, highly regulated industry. You want to clearly understand what's possible and what's not possible in the regulatory frameworks. I think that would be a great starting point. And I think the second and probably most important thing is, again, trying to first principles your way into building an amazing product. I think if you really think about what insurance is at its core, it's just pooling risk and then pricing it. It's just a very socialist almost system in the kind of capitalist markets. And so I think it's very hard to come in and just say, I'm going to automate these things. I'm going to change these things. Yeah, I'm going to move fast and break things, disrupt them. I think that doesn't work in the space. I think really understanding the fundamentals of insurance and what it means, and then going out and saying, I'm going to go and build something for the consumer. I think that's important. And the last thing I'll say also is it's not this consumer product that people have an unlimited need for. I think the need for insurance asymptotes for every family or every individual. And so recognizing that you're not building this consumer pull product, you're really building something that's a safety net for most people. And so when you're building something like that, it means your early adopters are most likely not going to be young people. And your consumers that do end up thinking about insurance are not thinking about it for more than once or twice a year. So then how do you start getting creative with your distribution channels, where you can then combine your product with how you distribute it and how you get in front of people? I think that ends up becoming a really important point for most kind of founders trying to start in the space.
Right. Yeah, I mean, nobody really wakes up thinking in the morning that, they need to get some critical healthcare insurance. And while they say, insurance, you can't solicit for insurance, but insurance is never bought, it's sold, right? I mean, you have to, it is a push product as you said. So, you're 2 years into your journey, you've just raised Series A. What are some high level challenges that you are solving as a founder right now? How do you see the journey ahead over the next 2 to 5 to 10 years?
I think the two biggest challenges that I am personally solving most of my time is hiring and kind of culture. So, everyone has talked about this, I'm sure. Hiring right now is quite a challenge, and it is madness. That's absolutely right. And I think there's so much inflation around for both talent and costs and everything. So I think, trying to assemble and get the highest quality team and get kind of almost a talent density at Loop, where we're then able to look at one another and say, these are the absolute best people possible that can be building such an ambitious thing, which is kind of trying to rewrite healthcare, rebuild the health system from scratch. That's one of the biggest challenges that I'm kind of trying to solve today. And the second one is our team has grown from 10 folks last year to now about 120. How do you get everyone rowing in the same direction? I think that is obviously one of the biggest challenges that most founders will end up solving.
Right. Yeah. Those are challenges I think you'll be solving for many years to come. Speaking of, I mean, how is the Pune tech ecosystem evolving? Like for us in Bangalore, it's not so visible, right? But how is the tech ecosystem evolving in Pune?
Yeah, I think I would say fast, but not as fast as I'd like. Obviously, I think there's a lot of great technical talent here. And having seen some early successes in maybe the IT services domain for a lot of companies in Pune, we're seeing a lot of talent exit, both on the business and the tech side, to then say, I want to work at early stage companies. And so I think we're pretty happy being in Pune and saying, we'll take all of the talent that wants to come in and experience what it's like to be at a startup.
Right. So, Mayank, this has been a fascinating chat. Thank you again for being on the podcast. Before we let you go, I'd love to get some book and podcast recommendations from you. What are your go-to books and podcasts?
Sure. Some go-to books. Obviously, there's one of our investors has written a book called On Healthcare by Hemant Taneja, General Catalyst. I think anyone trying to build in the healthcare or health insurance space, this is a must read for them. And so that, this is a book I see myself referring to a lot. I think Peter Thiel, kind of 0 to 1, still my favorite kind of business strategy books of all time. I think big fan of that. From a podcast perspective, honestly, I mean, thanks for having me here. I don't listen to too many podcasts. I have heard yours, and it's I think fascinating conversations with founders. So definitely have been kind of flipping through a lot of the episodes there. So love the work you're doing. The other podcast I just listen to for fun is the All In podcast. I'm sure
Right, of course.
you've been listening to that. Love the banter and love the honesty. Honestly, they bring to the conversation. So
Yeah, for sure. All right, Mayank, on that note, we'll end this podcast. Thank you so much again for being on the Startup Operator, and look forward to speaking with you shortly.
thanks, Roshan. Thanks for having me.
Thank you so much for listening. If you liked this episode, then don't forget to subscribe to us on your favorite platform and share this episode with all of your fellow startup operators. Also, follow the Startup Operator on LinkedIn and Twitter for more updates. Stay safe, take care, and see you soon on a brand new episode of the Startup Operator.